surgery is used to remove a cancer or repair an area of the body impacted by cancer. Surgery is often used in combination with radiotherapy and/or chemotherapy to make sure that any cancer cells remaining in the body are removed.
It's going to be very dependent on where that tumor is located. You can imagine that it's very different to have breast surgery as opposed to, for example, a tumor that sits in the uterus or sits in the lungs.
The way the surgery is performed depends on the type of cancer and its location. Types of surgical techniques for cancer can include open surgery to remove cancerous tissue, keyhole surgery where the surgeon makes a few small cuts and inserts a camera and light to guide the surgery, surgery using lasers to destroy cancerous tissue, and cryosurgery or cryotherapy where liquid nitrogen is sprayed onto the skin to freeze and kill skin cancers.
So it's a scalpel, it's an operation, it's almost always under general anesthesia, meaning that you'll be in the operating theater, you won't feel anything because you're asleep, and we then perform surgery. The point is that we have to remove the tumor radically, meaning that there's no tumor left, that we get all the lymph nodes that are naturally associated with that package of the tumor plus healthy tissue. And for that, in the old days, we used to do open surgery, meaning you get a big cut, we look at all the tissue, we find out where the tumor is, you locate it because you can feel it, and then you remove that package of the tumor plus healthy tissue plus the lymph nodes. That will tell us what stage the tumor is.
You may need to be admitted to hospital to have the surgery, although some procedures can be performed as an outpatient. You may experience some pain and discomfort from the surgery, along with some side effects from the general anesthetic, such as nausea, vomiting, dizziness, and agitation. Most complications are minor and can be treated easily.
We now use minimal invasive surgery, or also called laparoscopic surgery. And on top of that, we've now even are using robotic surgery. Depending on where the tumor sits, if you like, is located, different forms of techniques will be used, but almost always we will now try to find minimal invasive procedures that will give you the same result in terms of the radicality of the operation, but will give you less pain and an earlier recovery.